really glad that we're discussing it finally, and that we're not backing off of the anger and the emotion that comes with this issue. Why I'm here is I currently am employed in a county-based mental health clinic, and so I work with a lot of the people I think we're talking about who are needing this health care, the people who are serving us, service positions, who are not government covered and are not privately covered.
I'd just like to learn a little bit more about the health care before it gets voted on in Congress, and what they're going to do, and how Congressman Loebsack's viewpoints are. But then I also have a concern. I look at the VA hospital here in Iowa City, and I compare it to both Mercy Hospital and University Hospital, and sadly to say, I don't think it measures up to the other two hospitals in quality and just the atmosphere, if nothing else. Maybe the quality care is there, I'm not certain of that. But it just gives the impression that it just doesn't measure up near as good as the other two hospitals. And in my mind, those two in the VA hospital is taking care of our veterans, both guys and gals. And it seems to me if anybody should be getting the best care possible in the United States, it should be our veterans. Yeah. And I'm worried about if that's all the better care that those folks get, then what can an ordinary sputz like myself expect with government health care? I come here to hopefully learn more about what's going on and sort of thing. So, you know, that's pretty much why I'm here.
They're not picking sides, but they're just saying we need change. The status quo is unsustainable. So do something, not our patients need change. And so we're going to have a little event afterwards. Well, all silent. We're not going to be disruptive, but we're just going to share facts around people's lives about the cost of doing nothing on healthcare, how many people die. We're going to bring it down to the minute and down to the hour, so there are real people behind those statistics, right? That 2 people die every hour in this country because they lack health insurance, and some bankruptcy data. Things that put a human face on this debate, because it's too much focused on policy and politics, and we're talking about the lives of human beings here. And that's where I think the voice of healthcare providers comes in to bring back a sense of humanity to the craziness on both sides sometimes. So that's what we're doing here today.
According to the World Health Organization, the United States is ranked 37th in the world. Our healthcare system is broken. We have 46 million uninsured. We have a lot of people that could get insurance, but either don't have the resources, don't have the know-how, don't know how to. If everyone was covered under a public option and it was affordable, then we wouldn't have the problem that we're having right now.
I would like to see the President of the United States and the Democrat-controlled Congress seriously and responsibly look at health care reform. I would like them to take into consideration the very credible Republican proposals that have been presented, as opposed to going down this track of government takeover. Obama said in 2003 he's a proponent of a single-payer universal health care system. This is all just bait and switch. He wants to take over 17% of the United States economy, and I'm adamantly opposed to that.
And that this administration has no respect for the average common man getting up and going to work every day, paying taxes. It's making me sick how Washington, D.C. is living. The trips they're taking to check out global warming over in the Galapagos Islands, the Great Barrier Reef, Paris, they're checking things out and taking trips. And then we've done cap and trade that's going to destroy America. Now they want to take over health care. And if you read any book like Saul Alinsky's book and you read Marxist theory, they're going after it as full bore as they can. And if we don't stand up and be a voice, I would be ashamed of myself.
Guess what? It's expensed.
Yeah, but you see, my philosophy on that is, why would I want to have sick people? You know, it protects my health too. You know, something like the flu or preventative medicine is going to cut down costs. You know, every farmer in this state gets a handout. Every farmer. Nobody complains about that. Every farmer's.
I do.
And then the water pollution that's going on.
You you don't complain when you go buy inexpensive food at the market that's
No.
subsidized. You like that.
Yeah.
No.
Exactly.
Yeah,
Exactly.
you like that.
That's
yeah,
right.
you do.
Exactly.
Or you don't eat.
So this is just, it's part
Every
of the
bit
cost.
why don't you-
And then here's the other
Every bit
thing.
of food you pay,
If
you
I
buy
look at
is subsidized.
just if you look at every other
Why don't you
country
open up a
besides
free
ours,
market? Why don't you see how it works when we open up?
we don't have a free
we
market.
don't.
That's
No,
why
we don't.
that was my
Corporate
first
health
suggestion.
insurance
No
empire
insurance,
owns
pay
the
as you
market.
go. Do you want that? Just pay for your own health.
Yes,
Roll
I
the
would
dice.
take it. I would take
All
it.
right, then that's fine. Then
Can I
then
tell you
say that.
That's fine.
Say
That's
that.
fine.
Tell you, sir, that I do.
And you know what
Then
happens?
no
when you
insurance
pay
for anybody.
yourself?
None.
And you know what happens when you pay for
I do
yourself?
pay my own.
You know what happens
No,
when
you
pay for
don't.
your own?
You don't pay your own. If
You don't
say
pay-
if you
you
develop
don't-
if you develop a cancer or something like that, okay? How much is the cost is going to cost you to do a
You know
surgery?
what? I want you to stop talking and listen to me. My husband dropped dead of a heart attack
Okay.
6 years
So
ago.
what? Who doesn't drop dead?
Why don't you just excuse yourself
My
and
mother
stop
dropped
yelling
dead.
at me?
Now get back.
I would now like to introduce your Congressman, Dave Loebsack.
Can everyone hear me okay? I do tend to project a little bit, having been in a classroom like this for 20, not quite this big at Cornell College, but for 24 years. So if you can't hear me, let me know. And I'm really glad to be here today. This, as Dave said, is the fifth one out of 16 that I will have done by the end of the day on September 12th. We have 15 counties in the district. We have to do 2 in Lee County because we're at Fort Madison and Keokuk, and if I went to one and not the other, I wouldn't be able to go to the one I didn't go to for a town hall meeting. So that's why we have 16. I think it's fair to say we've had spirited discussion the first quarter. I anticipate that might be the case today as well. I do want to modify a little bit what Dave said about how we're going to do this. I really, given the first four that we've done, and, just sort of the intensity of the feelings on all sides of the healthcare issue, and that's really pretty much what we've been talking about. I want to make sure that if you have a rationale for your question, if you want to make a statement prior to your question, or even in lieu of a question, whatever, I want to give you the opportunity to do that. Not just get up and ask your question and then I respond and pontificate or whatever the case may be. I want to have it more so that you can express your views, pro, con, indifferent, whatever the case may be as well. Does that sound okay? What I'd like to do just to begin with, I want to just mention a few things about the bill that I voted for, and it's here. I have it. If anybody wants to look at it at any point, read it for yourselves, whatever. I am on the Education and Labor Committee. And that's, just so you know, in terms of the process, sort of where we are in all this. That's one of 3 committees in the House of Representatives that dealt with the healthcare issue prior to coming to the district for the recess for the district court period. We spent a considerable amount of time prior to actually looking at the bill itself in the committee, and a long time in the committee, marking up, as they say, the bill. I voted for H.R. 3200. I voted for this bill in the committee. And if you know that, and if you don't know that. I was able to get an amendment myself added to it in the committee, which passed overwhelmingly. There was really not any opposition to it on either side of the aisle. And that has to do with direct care workers, especially those of you who know about long-term care. You or a relative may be in a hospice or palliative care situation or something along those lines. And those direct care workers are the underpaid, underappreciated folks who are with those folks on a daily basis, on an hourly basis. And I want to make sure that we have enough of those folks as our country ages, as the state of Iowa ages. I want to make sure that we have that workforce out there. And the amendment that I got through in committee, which I hope stays in the final bill, if and when we pass a final bill. That amendment will help states identify their workforce shortages when it comes to direct